Welcome to this section of the virtual fair. This section will be a little bit different than some of the other sections in that we will be discussing kind of my pathway to neurosurgery and some of the various pathways that you could use to get into surgical subspecialties or surgical specialties, as well as some interesting kind of things to keep in mind as you are looking to apply to PA school. Don't hesitate to reach out with any questions as we're going through. I'm happy to answer any questions. So the first thing I started with is I want you to think about this little girl. This little girl was about a year old in this photo, and about a year later was diagnosed with something called pseudotumor cerebri. Pseudotumor cerebri is a diagnosis that didn't come easy. It was a lot of effort from her parents, but ultimately it required multiple lumbar punctures, multiple MRIs, multiple other testing. And subsequently, the child was then underwent a lumboperitoneal shunt placement at one of the children's hospitals. That lumboperitoneal shunt placement kind of changed her life. Prior to this, she did have visual deficits, had near complete vision loss with only a small area of tunnel vision, kind of in the central region. But in addition to that not only medically, but also kind of the procedure changed the whole trajectory of her life. While in the recovery, or kind of in the hospital recovering from the procedure, this little girl decided that when she gets bigger, she wants to help kids like herself. And so I think this kind of, you want to think back when you're applying to PA school, when you are working through applications, when you're working through your personal statements, when you're working through that interview process, and even more importantly, kind of when you get into PA school, you have to have this why behind you. And this little girl, that why was she wanted to help kids like herself. And so in that room while she was recovering, she actually declared to one of the providers that she wanted to help kids like herself. And so interestingly, that little girl was me, but that moment, that brief period in time actually changed my life and set me on a path to kind of get into medicine and get into neurosurgery. And so my passion really began at a very, very, very young age, 2 years old, honestly. And my parents still tell the story of me declaring this. And still to this day, I've had this persistent passion to be in neurosurgery. Do I expect every one of you to have this single monumental moment that kind of changes the trajectory of your life? No. But what I want you to think about as we kind of walk through is everybody's going to have different things that lead you to where you are in life. And you aren't going to be the same. And what you should highlight when you are working through your applications, when you are working on your personal statements, and when you are interviewing, is think about what's going to make you different. What is your why? In addition to being a neurosurgery PA, I am also a principal faculty at one of the PA programs. So my road to becoming a PA was very different than what I would consider to be quote unquote typical. I didn't just kind of go get my bachelor's and have this plan and then go straight into a PA program or take a gap year and go into PA program. My road is very different. And again, I would encourage you to highlight those differences when you get into kind of that application process. So I started by graduating high school back in, 2007. And prior to graduation, I was accepted into a BSMD program. Ever since I was 2, I determined I was going to be a neurosurgeon. I was going to go to medical school, complete a neurosurgery residency, possibly even a pediatric fellowship had been considered, and then go into work as a pediatric or traditional neurosurgeon. The third year of that program, which was my final year, I was asked or permitted to become a supplemental instructor for the anatomy course that they offered at the university. And in that course, I was kind of given the opportunity to be a group tutor. And that kind of changed my mind. I wasn't sure. It wasn't a total flip. Like I was guaranteed I wanted to go into education, but it was a flip in that I wasn't confident that medical school was for me. And so I kind of withdrew, and actually decided to run my parents' restaurant for 3 years. So I took 3 years off and ran my parents' restaurant. And in doing so, not only did I learn business skills, I learned how to talk to people, but that 3 years also gave me the ability to start exploring different career paths and different opportunities. About 3 years in, I kind of had this pivotal moment. I was taking care of a customer, and that moment I decided, you know what, this isn't for me. I can't do this for the rest of my life. And so at that point, I applied to a Master's of Science in Anatomy program, and I was accepted. And my thought at that point was, that's going to lend itself either to medicine or to teaching. And I knew that that was kind of my direction, was medicine or teaching. I just didn't know which way. And so ultimately, I graduated from that Master's of Science program, and that program was instrumental in kind of teaching me anatomy, but it also gave me an opportunity to teach at an undergraduate level. With regards to the undergraduate level, I was able to teach courses that repeated, and I realized at that point maybe education wasn't for me. I liked the challenge. But what I was teaching was anatomy and physiology. And as we all know, anatomy really doesn't change. There's some variations, but there's not big changes like there is in medicine. And so it became boring after some time. And I realized maybe anatomy education isn't for me. And so I applied to PA school after numerous shadowing hours, applied to PA school, and I was accepted and ultimately graduated from PA school. PA school kind of gave me some great opportunities. In my program, we had 3 electives, and those 3 electives I chose, they had what they called a neurosurgery track, and I chose to complete that neurosurgery track. That track allowed me 3 different types of exposures into the neurosurgery world. I had inpatient exposure, I had OR exposure, and then I had kind of the acute stroke, hemorrhagic stroke type of an exposure as the 3rd rotation. And so it just kind of continued to enhance this drive to be part of neurosurgery. Neurosurgery was always part of me, but that education side still lived, and it still was able to flourish. And it really kind of, the education side became more important and more apparent as I got out and accepted my first, actually 2 jobs. So when I got out, I accepted a role at a children's hospital where I covered basically a night shift, and covered 5 different pediatric and adult specialties. So in that role, I was covering the burn unit, which was pediatric and adult burns. I was covering ENT. I was covering pediatric general surgery, trauma, and adult cystic fibrosis. As a part-time role, the rotations that I had in PA school actually led to me being offered a part-time or a contingent role in neurosurgery at the organization that I had begun rotating in as a PA student. And so again, that neurosurgery passion lives on, but I got to kind of explore some of the other surgical specialties, and I really, really enjoyed the job, the night shift job, where I got to kind of work in multiple specialties, but still had this taste of neurosurgery, and neurosurgery still kind of became and continued to be my passion. And so about 2 years later, was offered a full-time position within the same organization that I had taken that part-time position. I was offered a full-time neurosurgery position and accepted that at that time. I have worked there, continue to work there for the last 4.5 years, almost 5 years. And I thoroughly enjoy that role. But again, education kept kind of coming back into my life. As I mentioned, education became more prominent in those first roles, and where it became prominent was not really educating students, but actually patient education. And so I really got to kind of enjoy both passions, the passion for medicine, neurosurgery, but also the passion to educate when I first took my job, because I was given not just the opportunities to kind of provide basic education, but really felt like I was making a difference when I was educating. And then after that full-time role in neurosurgery, I was able to help develop some educational materials for new trainees or new advanced practice providers that were added to our team. But in addition to that, I was also afforded the ability to become a faculty and adjunct faculty member at the university that I'm currently a full-time faculty member with now. But the difference, and the one thing I think that sets surgical PAs apart from everyone else, is surgical PAs work in a lot of different realms. And not every surgical PA, not every neurosurgery PA's job looks exactly the same. And I think that's important, and one thing to highlight when you are looking at your kind of preparation as far as any shadowing opportunities, any opportunities to get patient care hours, things along those lines. Keep in mind that it's nice to shadow multiple or get exposure to multiple areas because we don't all look alike. So just like you've probably heard before, a lot of PAs work in outpatient, but surgical PAs often work in outpatient, inpatient, and the OR, and complete, as part of their inpatient role, consults in the emergency department. And so again, that model or format's really going to depend on your organization, kind of the job description, that relationship you have with the surgeon, but it can involve multiple areas and multiple disciplines, multiple settings, I guess I should say. So from an outpatient standpoint, the surgical PA looks kind of similar to any other outpatient. So you're going to get histories, you're going to conduct physical exams, you're going to have the opportunity to make diagnoses. You're going to get to perform procedures, injections, some minor suturing, things along those lines. You can order testing, prescribe medication, you can make referrals, educating patients and families. And then one thing that's a little different from an outpatient standpoint is you will, in surgical fields, oftentimes you review some of your cases with the physician as needed or the surgeon as needed. And that's going to be a little bit different than some of the more autonomous specialties or areas, but something to keep in mind. And it's something that I enjoy because I always have that kind of back and forth with a surgeon. In some of the, I would say, other specialties where you are more autonomous, you don't necessarily have quite as close contact with your supervising physician. And so I enjoy that contact. I enjoy having those conversations, kind of bouncing ideas. But if you would like to practice more autonomously, that is something to kind of keep in mind when you are working in a surgical office. Now, in my practice, I do see patients independently. I have my own schedule independent of the physician. And I don't run every patient by the surgeon. I pick and choose kind of the ones I feel like I need to talk to them about. And otherwise, I don't necessarily reach out to them regarding patients unless I feel there's an issue or there's something that they need to be aware of. Or oftentimes I am trying to kind of give them, because I feel like they see on the back end some of the post-ops that don't go as well as expected. I always try to throw in some positive things as well. Because they typically, if things are going well, the patient doesn't necessarily have to see that surgeon again. Whereas if something is not going as well as expected, I will refer them back or have them go back and see the surgeon. So I do have conversations and I enjoy those conversations, but again, it's kind of as needed. Whereas in some practices, the PA will work kind of in tangent with the physician. And so where they may share a schedule and see the schedule in tandem, where the PA goes in, does that initial evaluation, history, physical exam, starts the documentation, and then that surgeon's kind of coming in behind and discussing that plan or the next steps. So the next topic is talking about the operating room. And so outpatient-wise, you do often have the opportunity to discuss surgical procedures with patients, provide that patient education as far as what does the surgical procedure look like and what the patient should expect kind of post-op and kind of the anticipatory guidance type stuff. But you also get the opportunity in some jobs to first assist. And first assist means that you're that person that's up at the table. You're not handing instruments unless needed. Typically, you're not grabbing them from the tray unless you're needed to. But what you are doing is holding the suction or applying suction. You're irrigating the area. In neurosurgery, we do a lot of kind of pulling bone off of some of the instruments. You may, in general surgery, do like operate the operative microscope. And one of the big things I think a lot of PAs enjoy is that you do get to be that person that's closing all of the incisions. And so that's a little bit different than some of the other areas or the other fields. Additionally, in the OR, sometimes you do get the opportunity to perform procedures. One of the areas where I've actually performed ventricular drains more regularly is in the OR, kind of preoperatively, but those can be performed on the floor as well, and we'll talk about that in the next slide. The other thing from a first assist standpoint is you can assist with monitoring that patient. Some PAs in neurosurgery actually go as far as placing screws. So there's a lot of opportunity to kind of participate in that procedure and help with that surgery. And interestingly, you are reimbursable as that person. So as a first assist, you are a person that can be reimbursed for from a cost standpoint. The last topic, or the last area, as I mentioned, was more inpatient, and I'm going to put our kind of inpatient and emergency department together here. So you, as a surgical PA, may get the opportunity to evaluate patients in both the emergency department, but also in the inpatient world. So if a patient's admitted and put on the floor, you would get an opportunity to evaluate those patients, and you can make recommendations as well. Interestingly, here, you, as a surgical PA, I feel like we have a little more contact with our physician colleagues, with our supervising physicians, than we do or at least I do in the outpatient world. But there's still some autonomy that you have the ability to make some decisions kind of without them intervening right away. Again, you're able to order testing, able to order medications, perform procedures, as I mentioned, the ventriculostomies, treat critically ill patients, and then having those conversations with family to discuss goals of care. I do see a question here. As a neurosurgery PA, how do you view neuromonitoring as direct patient care experience? I would say if you are performing the neuromonitoring, I would include that as direct patient care, because that is definitely providing care to patients, or helping to provide care to patients. So in my mind, I do see that as direct patient care. So how does my story help you? Because I feel like that's what this is about, is helping you to prepare for the PA programs that you're interested in, for that application process, and kind of what that looks like moving forward. So going back to that little girl we started with, again, I want you to really focus on your why. Like I said, the why is what's going to get you through PA school, because PA school is tough, but that why is going to be important. You also want to think about that why kind of at the front end when you are applying, or when you're looking at various programs, to figure out your interests, and to kind of, when you're writing your personal statement and while you're interviewing, that why is what's going to make you different. So think about your why kind of all the way through PA school, and you're going to need that why when you get out of PA school too, because burnout is real. And so that why is what kind of helps you to kind of recenter yourself and keep going and keep pursuing what you're interested in. So your road to becoming a PA, I would not expect to be identical to mine. It's not supposed to be. And I think one thing that you should take out of this is your path should never have to match anybody else's path. It's okay to be different. And I would encourage you to highlight those differences. When you're looking through that application, highlight why you did something that's a little bit different than what might be traditional. And it's okay to be, maybe you've got a lot more bumps in the road, and you're like, you know what, I want to go back, and this is interesting to me, and it's your second or your third career. It's okay. It's really okay. But again, highlight what those differences are and why those differences set you apart. Every experience is important. And as I mentioned, my experience as a manager at a restaurant actually still helps me to this day in my role as a PA and my role as an educator. It taught me how to talk to people. It taught me how to read people. It gave me connections. So all of that is, every experience you have can be applied in some way. There's a skill that you've learned that can be used in the road to becoming a PA. And so I would encourage you to kind of take a look back and look at how your experiences are going to impact you in your application process? How have they impacted the person you've become today? How are they going to impact you during PA school? And how are they going to impact you as a provider? And highlight that when you are kind of working through that application process. There's another question. As someone who is passionate about education, what ways can a PA do that in their career? So I would say I educate all the time. There's obviously PA education as one of your main options. But one of the big things that I do, and every PA has the opportunity, clinically practicing PA has the opportunity to do, is educate patients. When I see a patient, I treat those patients in a different way than some providers, because I spend a majority, after I've kind of made the diagnosis, I spend the majority of my treatment discussion educating them on, okay, this is what I see on your imaging. Let me show you. Let me explain to you why your symptoms are happening based on what I'm seeing or what I anticipate to find on your imaging. Let me explain why I expect this medication to work, what the side effects are. And I take the time to really educate the patient and their families so that when they walk out of that room, they are the ones that can own their care. They feel confident and comfortable in owning that care. Other ways a PA can do that in their career is as you move into more leadership roles, there's certainly abilities to educate team members. And I would say leadership has a little more, but colleagues have a lot of opportunity to educate team members. I constantly am bouncing ideas off of colleagues and talking to colleagues about various topics and pulling articles that I've found and saying, hey, did you see this article? How do you think that would apply to such and such patient? And so there's some education not only between colleagues, but also education kind of from a leadership standpoint. The other thing is there's always an opportunity to speak, especially if you're interested in educating, to speak at like CME conferences, but even as small as like your local organization. So recently I was given the opportunity to speak at an EMS conference at the local organization level. And so there are different opportunities that are kind of, or can become present as you dive into your role and become more notable in your role. But I would say education becomes inherent to the PA profession, and it's something that you should always keep at the forefront of kind of your thoughts and your expectations and going into PA school. And so the last kind of thing I would highlight here is experience. When you are kind of thinking about applying to PA school, the biggest thing I can tell you is get your experience, shadow, obtain those patient care hours. Take some time then to reflect on that. Any experience, as I mentioned, is valuable. Think back to, like I mentioned, the managerial experience. It taught me skills that I wouldn't have gotten necessarily in that same format in other ways. And so look at all of your experiences, whether it's shadowing, direct patient care, and think about how those experiences are going to kind of change you and shape you as you mold into that PA provider long-term. As you're getting this experience, I would also encourage you to think about where you might fit, but take the opportunity to make connections that might assist you along the way. If you're in a hospital setting working as like a patient care assistant, maybe there's a potential PA that is rounding on some of the patients as part of the hospitalist team, and you'd be interested in rotating with them as a potential preceptor. If your school might allow, that would be something that you might be able to request that preceptor. Is there a future colleague? So if you go to school and graduate, maybe that connection that you made is able to write a letter of recommendation or become that future colleague where you can ask questions to after PA school. The other thing I would encourage is consider areas of medicine that you are interested in, but don't limit yourself, and recognize that these interests can definitely change as you're exposed to more and more experiences throughout your didactic and clinical semesters. They help you to kind of, I guess, get an idea of which PA program is right for you. And the reason in particular that I say that is if you're interested in surgery, one example might be considering the way anatomy is taught. If you're interested in kind of that first assist role, perhaps a dissection or a program with cadaver dissection is better for you than something that might use prosection or models. And so if you have this passion or this area of interest that's very passionate for you, just keep that in mind as you're looking at PA programs, because there's differences between the programs that might set one kind of apart from the others, as far as preparation for your future goals. If you don't have a specific interest, that's okay too. Part of it is recognizing things that you don't want to do. And so, like I said, just kind of be aware and take the information in. Don't put all your eggs in one basket, because again, I would discourage that 100%, because when you get there, oftentimes you will make changes and you will have experiences that may change your mind. But kind of take it into consideration when you are looking at programs, especially if you have this like burning desire, this big interest. Again, the other thought I have is, if you have an interest in research, look at the research component to various programs. Some schools have a smaller research component. Some schools have a larger research component. Some programs have you graduate with multiple degrees. So just kind of take into consideration your interest when you are really identifying a school that fits. Are there any other questions that I can answer? I think I missed a question from Cameron a little ways back, and I know part of the team's trying to answer that. But I will speak to the PA's play in leadership. PAs and leadership can range in a variety of roles. Leadership can be kind of on a committee within the organization. For example, like an advanced practice provider council has a chair or has specific committees under that. So leadership can be kind of as part of a committee. There are clinical leads in some places, and it kind of moves up, and quite a bit of leadership opportunities are it seems to be popping up as far as for advanced practice providers. And so I would say the leadership, the ability of a PA to be a leader is growing, but there's definite opportunities, like I said, whether that be on committees at your local organization, and extending up into higher management. And then the other thing I would say is leadership within organizations like the AAPA, PAEA, your state organizations. Those are another way that PAs can get involved in leadership. Let's see. If you were to switch a specialty to work in, how would that process work? So that's one of the great things about being a PA, is that we can switch if we choose. We are trained as generalists. Choosing a specialty is, I don't want to say it's hard, but coming out of school and going right into a specialty and really into any role, you should expect to continue to learn for quite some time after graduating. I think the biggest thing is, if you choose to switch to a different specialty, is recognize that learning period is going to be really intense right after that switch, and then kind of slowly taper down. But I would say it never ends. We always are learning, and that's the same with whether you're 30 years into neurosurgery or it's your first year. There's always learning. It's just how much learning do you have to do to be successful at the time. In my personal statement, is it okay to talk about my interest in education as a PA when my career is more developed, like speaking at conferences or teaching, or should I stick to current times so I sound committed to the profession? I don't know that I have a personal preference there. I think if you are interested in education, I would kind of tie that in somehow. As a PA, there are PA educators, and so I think that's important to highlight if you're interested in education, but also keep in mind how that interest in education is going to help you as a clinically practicing PA as well. So I would kind of tie both together if possible, to show that interest in education, but also tie it into how are you going to use that interest as a clinically practicing PA. Any other questions? Any advice regarding shadowing, in regards to shadowing and documenting? So I would encourage you to kind of look at the program that or programs that you're interested in applying to. As far as documenting shadowing hours, each program may have a different form or different requirement. So I would recommend reaching out to that program or programs that you're interested in just to see what their requirements are regarding shadowing and then documenting those hours. All right. If nobody else has any questions, I did put my email up there. Feel free to reach out to me via email if you have any additional questions or concerns. Have a great afternoon.